set?
All set, sir.
Great. Well, thank you everyone for coming today, and let's get right to the numbers. Today we've had a total of 235 new cases, and that number has stayed right around 250, 240 for the last 10 days. So we've got increasing confidence that we're at that plateau right now from our original model back in early April. So that takes our cases up to about 6,800, well, 6,837 cases. We lost 6 people overnight, very sad for their loss. We got 2 more days in this week. If we have 5 or fewer deaths, this will be the lowest week for deaths in, a month. Now, we just don't know what will happen in those 2 days, but hopefully that will be a good trend. About 80% of the people that are getting sick right now who tell us about their employment are in those critical infrastructure companies that have been opened. And this makes sense because those of you who are working from home are around less people. About half the people that are reporting illness and testing positive don't have an underlying, these are hospitalizations. About half of those hospitalizations don't have an underlying health condition. So it is a bad disease to get. You don't want to get it if you can keep from it. And about 2/3 of the folks who have been hospitalized are actually under the age of 65. Although about 40% of our deaths are in nursing homes, probably less than 10% of our cases are actually in nursing homes, which pushes you towards realizing that that's a very vulnerable population. I'm glad we're going to be working with the state to get them all tested. We've been working on that and doing that through Parkland for about 3 weeks, but now we're going to be able to get it done even faster with help from the state. I want to roll out a new program that we've got, and I don't know if it's up there or not. So we've got a new program called Stay Safe Business, all right? So here's how Stay Safe Business works. We got a letter a couple of days ago from the Attorney General saying that the governor didn't actually want any sort of requirements around the recommendations that he had made for businesses. Understandably, the businesses here were concerned that a few businesses that wouldn't follow safe practices might mess it up for all of them. So we had a lot of talks the day after we got the letter, and the business community and I came up with Stay Safe Business. Here's how Stay Safe Business works. Businesses that will take a pledge to continue doing those things that we have worked with them and they've agreed to do. Let me read you some of those things. There's things like checking employees' temperature prior to work, having employees wear masks, keeping 6-foot distance and physical separation between employees to the greatest extent possible, providing soap and water hand sanitizer at the workplace, allowing non-essential personnel to work from home, and then things specific to their business like 6-foot separation and plexiglass at the checkout lines in grocery stores. Things that are specific to that business and those general things. If they take that pledge and they do those things, and that's step 1, and step 2 is if their activity is, switch to this other one real fast, the safer color. If their activity is in the color that we're in now. So for instance, right now we're in red, so grocery stores, shopping in grocery stores is recommended by public health, okay? But conversely, there are other activities going into large crowds that are not recommended by public health. And so, one, they've got to promise to follow those guidelines that are pre-existing. And 2, their activity has to be in the color that we're currently in to be recommended by public health. So for instance, we can't take those vacations. You can take a vacation under the law anytime you want to, but public health says don't travel and take vacations until we get to yellow. And so similarly, I think public health on haircuts, and as you can see, I haven't gotten one. Public health on haircuts is saying for people under 65, when we've had that 14-day decline, and you get to the point where we're at orange, it's safe for those of us who don't have underlying health conditions and are under 65 to get a haircut. For people over 65 and people who have that underlying health condition, public health would like to see you get to yellow. Again, these are all voluntary. Being a Stay Safe business is a voluntary thing. I think what will happen, of course, is patrons will look to see if what businesses are safe. Over and over again, and I hear this from business every day, and I hear it from, of course, constituents. People want to know not what can I do, but well, what should I do? What's safe? What do the doctors say is safe? And so this will further help with that. We're still encouraging people to download that document from the doctors with all the activities, which you can get at Dallas County COVID, dallascountycovid.org. But also you'll see more and more of these businesses that have these insignias, and that should give you a high degree of confidence in shopping there and frequenting there. On testing news, got some good news on testing. So Ellis Davis, we have enough kits to keep Ellis Davis open until the end of July. And again, you know, these things, we continue to work on this. It doesn't mean we're going to close at the end of July. It just means that's what we have today for that one. For AAC, we have until June 30th. We have federal kits for June 30th. We're going to work to keep whatever testing we have now, but we're going to have to increase our testing. Right now, we don't have near enough testing to safely reopen. We're dead last in the country here in Texas on testing, so we've got to get more. And along that line, starting tomorrow, Walmart will have 4 locations, one at 15757 Coit Road, which is north of 635, one at the DeSoto Walmart, which is 951 West Beltline, one at one of the Garland Walmarts at 5302 North Garland Avenue, and the last one at the Rowlett Walmart, which is at 2501 Lakeview Parkway. Now, these sites are supported by Walmart, eTrue North, and state and local officials to test anyone who meets CDC and state and local guidelines on who should be tested. And this includes first responders, healthcare workers, and others with symptoms of COVID-19, and those in high-risk groups, like over 65 or underlying condition, without symptoms. Those interested, and I don't know if we have a graphic for this, I don't know if we do or not, I didn't ask for one, so I probably messed that up. So I'm going to say this slowly. Those interested in being tested need to visit www, all run together, Do I Need a COVID-19 Test? Do I Need a COVID-19 Test.com to see if they are eligible for testing or to make an appointment. And I will turn it over to Phil now, and thank you for being here today. Phil?
As the judge mentioned, we're reporting 235 new cases today. Total case count 6,837, and then the 6 new deaths, bringing the total number of deaths to 159. In the county jail, we now have a total of 304 inmates been confirmed positive, and 29 jail employees been positive. At the TDCJ jail facilities, their Medical Action Center is reporting 19 COVID-19 positive tests among current inmates and 25 employees. At Hutchins State Jail, also 2 COVID-19 deaths reported among inmates at Hutchins State Jail. 3 TDCJ officers from the Beto unit in Anderson County are COVID positive, and reported as Dallas County residents are COVID positive. Homeless shelter, a total of 47 residents now with Dallas Life. In terms of long-term care facilities, Monticello West has 42 residents or staff and 20 deaths. Skyline Nursing Facility has 60 residents or staff and 3 deaths. The Reserve at Richardson has 15 residents and 3 deaths. Brentwood Place 1 has 93 residents or staff and 10 deaths. Brentwood Place 2 has 20 residents or staff and 1 death. Duncanville Health and Rehab has 32 residents or staff and 2 deaths. Avenues of Park Forest has 7 residents and 0 deaths. Madison on Marsh has 2 residents, 0 deaths. Presbyterian Village North has 19 residents or staff and 1 death. Village at Richardson has 24 residents or staff and 3 deaths. Balch Springs Nursing Home has 1 resident and 1 death. Edgewood Rehab and Care Center has 49 residents or staff and 4 deaths. Avante Rehab Center has 30 residents or staff and 0 deaths. Grand Brook Memory Care has 1 resident and 1 death. Lake West Rehab and Skilled Care has 10 residents or staff and 1 death. Maynard Segoville has 27 residents or staff and 1 death. Northgate Plaza Nursing and Rehab has 6 residents or staff and 0 deaths. Signature Point has 7 residents or staff and 1 death. Millbrook Healthcare and Rehab has 1 resident and 0 deaths. And in Trust of DeSoto Memory Care has 6 residents or staff and 0 deaths. And finally, Linden Park Rehab and Nursing Center has 2 residents or staff and 0 deaths. As the judge pointed out, we're still in the red zone for stay home, stay safe. The indicators that we're looking for to move from red to orange are, I'll show you our current status on some of those. So next slide. So these, one of the things, emergency room visits for suspected COVID-19 in the last 24 hours in Dallas County. You can see it's been pretty flat the last couple weeks. Overall, slightly increasing trend since the start, but certainly no declines seen at this point. The new ICU admissions in the last 24 hours for suspected COVID-19, again, fairly flat. Overall trend is still, if you start from the beginning, still increasing slightly, but certainly no 14-day decline seen. This is just looking at the available ICU beds in the county. Again, slightly flat. Overall trend that there's been an increase in the number of available beds, but again, no significant change really in the last couple weeks. Next. The suspected med-surg admissions for COVID-19 in the last 24 hours is, again, increasing. Next slide. Suspected ICU admits, again, increasing. And then these are the actual just hospitalizations that are in the hospital for COVID-19 in the general hospital beds. Again, no decline. Actually, the last week has been some of the highest numbers, and overall trend has been increasing. And then for the current lab-confirmed COVID-19 in the ICU, last slide, I think, again, that's been pretty much flat. Certainly no decline in that. And some, this week has been as high, certainly as it's been. What we're looking for, again, is 14 days of decline in these indicators, and then we can move to the next level, the orange. But thus far, we have not seen that. So.
Any questions?
Yes. Judge, you, with the Stay Safe Business program, I'm curious how you all are going to kind of evaluate, determine a business is kind of worthy of, I guess, this, certification is the best way to put it, but how are you all going to kind of determine whether a business is worthy of participating in the program and is maintaining these standards that you're hoping they're going to maintain to keep that insignia?
Sure. So the question was, how do you evaluate a business to determine whether they can be in the Stay Safe program? And it's a 2-pronged test. One, they take a pledge and they follow, and the businesses have been great about doing this. They follow those guidelines that we've worked on, that they've been following for the last whatever it's been, 5 or 6 weeks. That's thing one. And then thing two is, and they follow those specific to their industry, that were worked out with them, with public health and them on calls before we started doing those. And by the way, business has been tremendous on this. So in Dallas County, there's been less than a dozen citations written on businesses for doing things outside of the rules. And I don't know if any of those have actually resulted in anyone paying a fine. They probably just fixed it. So that's step one. Step two, that's equally important, is the economy is opening based on who's the loudest voices, right? And the loudest voices, unfortunately, are not necessarily science. But our local scientists, our local chiefs of epidemiology, infectious disease, public health professionals like Dr. Wong, CEOs of hospitals, they've looked at all this and they've said, here's what we recommend, those of us whose specialty is infectious disease pandemics, here's what we recommend that is safe. So the business has to be one of the ones that they recommend, one of the activities that they recommend is safe. It has to be in the right color code. So if your business, for instance, is, getting large groups of people together, then you're probably not in the red color zone, so you wouldn't have one. When we get to that place on that doctor sheet that you can find at dallascountycovid.org, where your business is, then you can get one. If, unfortunately, we see an incline, there was a paper put out by UT Southwestern that if we continue on the current course that we're on with this increased activity that we're seeing, that one of the estimates is that we'd be at about 800 cases a day in July. I hope that doesn't turn out to be true. Obviously, if we manage to work our way down to yellow, and then we were up at 800 cases a day, we'd be back up, in red. And so businesses that the doctor said it was safe to do it before, if we go the wrong way, they wouldn't be able to keep that certificate until we get back to their color. Is that helpful?
Yeah, I guess the only other follow-up is, is the county going to have people, actively driving around to make sure these businesses are continuing to comply? If, as the example you mentioned, if the case is surged again and a business that had opened
Sure.
no longer was a safe place to be.
Right. So we would tell the business, if your business to be a safe place business, you need to be in, the county needs to be in yellow under the public health, and we go the wrong way and we're back at orange or red, we'd let you know, you're great, but unfortunately we're at orange again, so yank that down, we'll put it back up just as soon as we get back to yellow. As far as going to check on people, the businesses have really been great. They kind of check up on each other, to be honest, and also and I mean that in a good way. They'll say, hey, I'm trying something in my store. It's working great. Why don't you try this thing? And they've really helped each other to make things safe. I may have mentioned this, but we are the only metro area that the Texas retailers and I can find, and we're very proud of this. And I'm talking the 4 counties, right? Only one that hasn't had some sort of an outbreak in a customer-facing business. Now, we've had outbreaks in jails and of course, meat packing plants and nursing homes. But as far as things that customers shop at, we hadn't had those because our businesses have done such a good job, and we want to keep doing that. Also, I think customers, if you go into a business, let's say you go into a restaurant, and the restaurant has that sign, which you have to wait until the color changes for the restaurant to get it. But so they go in, but they can see all the tables are within 6 feet, and the wait staff's not wearing their mask. If they tell us, then we'll check with the business. But the businesses are pretty good about doing that. Any other questions?
Just on the status of, you released a statement, I know, responding to the Attorney General's letter. Has your office had any more conversations with the AG's office, and are you planning to modify your order? I know I think it expires tomorrow as is, but are you planning to do anything additional to appease some of the concerns that he passed along?
Sure. So the question, because I don't think you're Mike, the question is, we got a letter from the AG. Do you plan on doing things to, modify your order to appease his concerns? As you pointed out, our order expires actually at midnight tonight. What the AG has effectively done is he's made it very hard to have requirements to actually require people follow what the governor says he wants them to do. So it's kind of like, I'm saying I want you to do something, but I don't necessarily care whether you do it or not. So it really leaves us in a tough spot. But let me say this: here's the burden on people who have to make these decisions. Shoulders can be heavy, but those burdens are going to get shifted more to our small business owners, right? And another important constituency, and let me talk to that constituency real fast. We all know who makes decisions in families about what's safe and where we go and what we do, right? And by and large, that is mamas. So if you are the matriarch or the decision maker in your family, please download from DallasCountyCovid.org this guideline from the doctors, and use that to help your family make good, smart decisions, because it's getting increasingly difficult for us to do the things that we were doing to keep you safe, but you can still do the things that need to be done to keep you safe, and we're going to help you through that. We're going to incentivize people with stay safe business. We're going to give you color-coded charts. We're going to make every effort to give you the information that you need so that you can keep yourself safe and keep the community safe. In that UT Southwestern deck, the PowerPoint deck that went out yesterday, there's a huge difference between if we have 57% of the people comply with safe distancing and mask wearing, et cetera, and 69%. I can't remember exactly the numbers, but it's like 1,000 cases a day at 57%, and it's 200 cases a day at 69%. So it's really up to each of us to make those good decisions to protect ourselves and our community. Any last questions? If not.
I have a couple questions about the, I believe tomorrow you've got a couple of orders, one on food processing plants and one on the nursing home and long-term care reporting and notification. Are there any plans to extend those?
Yes.
Both of them?
Yes.
Do you know about how long that would go through then?
I don't know how long it would go. It would go as long as I'm sorry, you're not Mike. There's questions about nursing home report. There are orders that would extend. Things like the requirement for private labs to report how many tests they've done, although we're still struggling to get accurate numbers. But anyway, that and nursing home things. You mentioned something about meat packing plants, so those things would extend, yes. Thank you so much, all of you. Did you have another question? You said you had two questions. Did that cover both of them?
Yeah, and I was hoping to follow a little bit more on those two Southwestern there.
What's that?
Can I ask, I was hoping afterward just to follow up a little bit more.
Sure, sure. Thank you so much, everyone, and have a. Oh, and can I say one last thing? Speaking of mamas, okay, my mama is double ocho today. All right, she's it's happy birthday, mama. And that brings one last point, right? As you're thinking about what you do, you need to think about the people that are vulnerable in your house and your community, right? If you're taking food every day to mama, or if mama lives with you, you might want to treat, or you do, according to the doctors, want to treat that color chart as if you are over 65, because you don't want to take anything back to that vulnerable child or vulnerable person, whoever that vulnerable person is in the household. So thank you all, and happy birthday, mama.
So the Stay Safe business can actually be like the stickers that businesses put in the window?
Right.
Okay.
Right.
Do you know if any of businesses are already participating, or has that not been rolled out yet?
Well, I know a lot of the Texas retailers would.
Okay.
Because they are actually the ones that come up with the idea.
Okay.
Yeah.
So do you know if any off the top of your head?
Probably just about every year. Some big mean, they don't already have it, because we literally just
rolled on,
made this
okay,
thing
that's what I
up
was curious about.
like 2 hours ago.
Okay, that was curious.
Sure.
Thanks.
All right, you have-
Holly Hacker behind the mask.
Hey,
Yeah, hi, thanks. I just was hoping to catch a little bit more. We're doing a story tomorrow on the UT Southwestern model. And, here are my questions. Let's see. You mentioned it, was it?
Want to go outside?
Wait, when you go outside? Okay. First,
Speaking of
you're
that, we should
actually-
check with Katie, or maybe it's my inbox. Did I need to approve something to get that little supplemental order out?
Okay.
One, you
Yeah,
talked
yeah,
to her.
yeah.
on-
Okay.
Oh, you need to stand?
Yeah.
Jesus Christ.
And don't forget your haircut.
¿Quieres ver la de business también o solo esa?
Esta nada más ahorita.
Sí, porque necesito escribir esto.
Ok. Entonces,
Me dices. Ay, Dios, qué calor.
Dímelo, yo con suéter, pero en la noche se pone frío.
ok.
Y también estaba la de los casos. Do you want to see any of the slides from the doctor, or you got those, las que mostró el doctor?
¿Eso lo tienes en PDF? ¿Lo podrías mandar?
No en PDF.
¿Está en PowerPoint?
Deja pregunto si
¿Y
lo
de qué
tenemos.
son las otras? Disculpe, no escuché bien.
De caso, o sea, como todas las cifras de cuántos
Todos los nursing
hospitalizados,
homes, ¿verdad?
no solamente los nursing homes, sino la gente que está en los hospitales con COVID-19.
Dale si quieres, a ver si lo tienes ahí para tomarle una foto. Y hacer la entrevista porque me quieren a las 5.
No es cierto.
Sí.
Ok.
Sí, esto básicamente son todas las hospitalizaciones por COVID-19. Entonces vemos que es una cifra que se ha mantenido estable en las últimas semanas.